Cosmetic surgery has changed dramatically over the last decade, and when it comes to facial plastic surgery, Dr. Brent Smith has helped lead the way in innovative techniques.
My focus is the face. This isn't something I dabble in. It's what I specialize in. I teach this internationally.
Since 1988, Dr. Smith has performed face and neck surgery on 3,000 patients in the Denver area. One of the latest trends in facelifts is what Dr. Smith calls a mini lift, or a cheek and neck lift. It's what he and his expert team members are performing here.
I think that with a mini lift, it would primarily focus on the cheek, neck, and jowl area. And with that, we will do work in the neck area to take care of some of the cords and bands. If there's fat that needs to be addressed, it would include maybe some liposuction.
One technique Dr. Smith prides himself on is the fact that he lifts the muscle underneath the skin. He doesn't just tighten the skin itself.
And that's absolutely key for the procedure, because we work on the muscle. The skin in and of itself doesn't have any shape or support.
Laurie Goings knows how well this technique works firsthand. She's one of Dr. Smith's registered nurses, but she was his patient first. This is Laurie's picture before her cheek and neck lift. This is her post-surgery photo. Now you'd never guess her age.
I'm 54. Just became a grandma. Yeah.
Congratulations.
Yeah.
So do you feel like the sexiest grandma out there?
Not the sexiest, but I do feel, refreshed. I feel like I, don't look like what I remembered my grandma looking like.
Here are several more proud patients who came to Dr. Smith for their mini lifts. They each have dramatically positive results. But not all plastic surgeons are created equal. A quick Google search will net countless blogs about facelifts gone bad. Dr. Smith says reputable surgeons will insist on thorough consultations, and they want patients who've done their homework on the doctor's background.
They may be going off and taking a weekend course, and they watch videos of a doctor doing a procedure, and then they go out and decide, okay, I think I'm ready to do it in my office, without really the adequate training. I spent 6 years in training after medical school to do what I'm doing, and it boggles my mind to think that there are people going out after one weekend and trying to do these type of procedures.
With the newer techniques and more frequent use of lasers, incisions have been greatly reduced, which means faster healing and minimized scarring. You can't even see Laurie's scars.
Up here, down, inside the ear, along the earlobe, and then in back, and with an incision back here. It was very, very simple. The pain is minimal. I wouldn't even call it pain, it's more discomfort. It's well worth doing.
Whether you're considering a forehead lift, an eye tuck, a cheek and neck lift, or all of the above, it's important to take your time, check out references, and even speak with other patients. But Laurie suggests taking the plunge sooner than later.
Patients tell me all the time, well, I should wait till I'm older. Don't wait till you're older. Do it now, because then you get to enjoy it.
I've had patients come into my office and say, well, I can spot someone who's had a facelift from a mile away. And I say, no, you can spot the bad ones from a mile away. The good ones, you never know.
Exactly, like the bad ones are like this, you know those. So we know you have a lot of questions about plastic surgery. So we asked Dr. Smith to join us this morning. He is here to answer your phone call, so definitely give us a ring, 303 Martino. He's here to answer your questions. But first, so Tom, I know you've got a thing or two to say about plastic surgery. What do you think?
That's my hot button today, Paula.
Of course.
And I have a couple things to say, okay? Maybe first, I want to say that it's no big deal. But for some reason, we make it a big deal. You know, we don't make it a big deal when people have their appendix removed, but when they have work done, I had a deviated septum. I couldn't breathe right. I went to Dr. Smith to have it fixed. I did. He did it. And he said, hey, Tom, while I'm at it, I can straighten that nose because I had broken in, and I can remove extra cartilage. I said, cool, go ahead. Well, I never heard the end of it. Wow, people said, your nose looks great. Did you have work done? People said, because it was so crooked before. And so that's what they wanted to make a big deal about. And I have to say this, okay? People always ask when someone looks good, did you have work done? And people usually say, well, no, I'm just working out or I'm watching my diet. Why? Because we want it both ways. We want the plastic surgeon to make us look great naturally, but when we see him walking down the street, we pretend we don't know him. So there are some, of course, that you can't deny. You don't ever ask, did you have work done? Because it's so obvious, it's so obvious that you don't want to bring attention to it. So you see, plastic surgeons have a dilemma. They want you to look good, and if done right, no one will ever know they did anything, and no one will give them credit. The really good ones are behind-the-scenes heroes. So my Purple People Meter today is asking this in the privacy of your home. Okay, would you have plastic surgery done, huh? Or do you think, no, this is something I'd never do? Now we have people voting no right away, of course, and these are the people that are phony. They're the ones that'll go and say, I want you to do this, but don't tell anybody. And I want to hear from you on the phone, 303-627-8466. Dr. Smith even has a back door in his office, so you can come and go without people seeing you. I know that because I used it, and because I didn't want people knowing my business. Isn't that a weird kind of? That's a weird kind of job you have. People don't really want to admit.
It's a little bit secretive.
They don't want to admit they've been to you.
It is. You know, to be honest, I don't even share who's been to my office with my wife, because that way she really doesn't have to know who she has to be quiet about and who she doesn't. If she's heard that someone's had something done, it's probably common knowledge, and she can talk about it.
Yeah, I would think discretion is key in this line of work. Thank you so much for joining us live this morning. We appreciate it. We know a lot of people are going to have some questions. Give us a ring at 303-MARTINO if you'd like to ask Dr. Smith something specific. But let's talk about some of the other trends in surgery. We saw the mini facelift.
What are people doing?
Yeah.
Well, I think at this stage, especially with this economy, people are looking for maybe one little thing that's going to make a difference for them, and they'll focus on that. And it may not be the big deal. We still have people coming in who want, you know, the full meal deal, if you will.
Yeah.
But for the most part, we're seeing people who come in and say, you know, I just need a little tweak here, I need a little tune-up, and what can you do? Is there something that you can do, because I have my class reunion coming up in a couple months?
And you do something with eyes for men and women, the eye lifts for getting rid of those bags, and that doesn't even require a facelift, does it?
No, you know, it's a less invasive procedure.
Don't ask me how I know that. Go ahead.
It's a less invasive procedure, and the healing process is very fast. I actually had mine, I was turning 50 and had mine done about 3 years ago, and I still challenge people to see if they can see where my incisions are.
Yeah, that was fascinating to see. It's almost like you just take a little crimp or something and just crimp it, and it's
amazing.
There's
how it
no
works.
bleeding or anything. It's just quickly sealed.
Yeah.
Is that
it was really
is that
tricky
because of
doing my own in the mirror, but not really.
Quite talented.
So why did you choose to specialize?
You know, I just think that that's the trend in almost everything, not just medicine, but we're seeing people who focus in one area. And when you do that, you can do a better job with that. You have, your equipment is all set up to do that type of procedure. All of the training I go to is focused on the face. And that's really my passion. It's been my passion since I started medical school.
And you've been there to help develop some of these techniques. You said you've had doctors in from Russia, from Australia, you know, training them in some of these techniques.
We've developed some techniques that accelerate the healing process, use lasers to do the procedures.
Supplements you do?
Exactly. And I guess I've developed a pretty good reputation on that, so we've had people fly in from all over the world to come and watch.
He has you start on supplements before surgery, so when you go into surgery, it'll be better healing.
So the use of supplements, the use of lasers, and then any other post-surgical things that you do to help healing time?
We have a hyperbaric oxygen chamber, which is kind of a pressurized unit that one would get into. And when we put you under pressure, your blood will take up more oxygen, and it can then take that to the tissues that heal. And we're the only office in Colorado that has an on-site.
My scarring, I mean, noses can make you look really bad.
Yeah. Sure.
And I had a lot of excess cartilage, and I think in 2 weeks I was on TV. Well, you remember.
Yeah, I was working with you, yeah.
You hardly knew that I had it done. By the way, what should people look out for when they go for a consultation? This is important.
Well, I think you should have a chance to meet the doctor.
Okay,
that seems vital.
Not just a consultant.
All kinds of questions.
Exactly. Ask a lot of questions, and ask how many of these procedures do they do.
Exactly.
And can they talk to patients who have had it done?
Good stuff.
Yeah, great advice.
And obviously I think that board certification is important, but for the most part, that means that you're a pretty good test taker. And most doctors are pretty good test takers.
So it's not wrong to ask for references, and there are many patients that will agree to do that. By the way, to reach Dr. Brent Smith for more information, 303-741-2211. That's 303-741-2211, or SmithCosmeticSurgery.com, SmithCosmeticSurgery.com. The important thing, he'll stick around for a few minutes if you have questions. 303-627-8466. That's 303-MARTINO. So please call. And we have more coming up.
That's right. I just want to thank him, too, again, real quick, for letting us behind the scenes. That was fascinating. I appreciate that. All right.
Tom Martino back with you with Dr. Brent Smith, a renowned cosmetic surgeon. Annette's on the phone, has a question for us. Go ahead, Annette.
Hi there. Just trying to get a bottom line. It doesn't have to be exact. As far as cost-wise, for kind of sagging skin. Really
Dr. Smith, a lot of people ask that.
Yeah. Well, you know, it depends on the area we're working on. If we're kind of thinking the lower half of the face, the neck, the cheek, and the jowl, you're probably looking at somewhere around $8,000 to $9,000. That would include anesthesia. It would include the facility and
all aftercare.
All aftercare.
What about that light facelift with just these two areas put together? What would that be?
Well, if we're just focusing on maybe the mid-face, that may be around $4,800.
Okay. And so altogether, tell me the range from low end for just eyes all the way up.
You know, we have things that people can come in and have done for $150 or so.
Right, fillers and stuff. What about for eyes, an eye lift?
The eye lifts, if we're doing the uppers alone, it's around $3,600. Upper and lower is going to be around $6,200.
Keep in mind, please don't shop price. If you don't have the money, save the money.
Exactly.
Don't go cheaper. I'm serious. Go with experience when it comes to your face. Okay, we're going to switch gears now. Dr. Smith will stick around. Hi. Tom Martino back on Martino TV. Dr. Brent Smith, plastic surgeon with us. We had a caller, wanted to know about acne scarring.
Okay.
And I'm sure you get that a lot.
We get that a lot, and we actually have some lasers that are very effective for that. We have a laser that is a new laser called a firm fractional CO2 laser. I actually had it done 3 weeks ago myself. I had it done for little brown spots, little precancerous things, and fine wrinkles, but we have seen incredible results with this for acne scars. And the nice thing about this laser is it will heal in about 3 days as opposed to some of the others which would take weeks.
Thank you very much. Okay, we have more show coming up now. We're going to switch to another. Okay, I'm Tom Martino with Dr. Brent Smith. We had a caller, and we're summarizing these questions in the interest of time. Moles, I'm sure you get that. What about moles?
Well, a lot of the moles arise in the top layers of the skin, and so we can do a shave excision of those and take those off and virtually heal without a scar at all.
Really?
Otherwise, we might be able to laser them and remove them in that way.
So they don't always require surgery.
No, but you know, if they're suspicious looking, then we're going to take them out and send them off to the pathologist too, because we want to make sure that they don't represent any type of a little skin cancer or anything like that.
You reference lasers a lot. You guys are the ultimate professionals with lasers. You do a lot with them.
We have 8 different lasers in our office, so we can pick and choose what's going to be the best laser for that patient, whereas some other doctors it might be, okay, this is the laser I have, this is what you're going to get.
And it's important to note that many things that used to take surgery now can be done with a laser.
Exactly.
Do you give free complimentary consultations?
We do, and those are with me. So
with you directly.
Yeah, and then we can many times do computer imaging where we can take a picture of the patient and maybe show them what they might look like after surgery as well.
All right, so Dr. Brent Smith available for complimentary consultations. They do computer imaging. I know I went through the process, and if you want to okay, Betty, is it? Did you say Betty? Okay, sorry, Betty. No problem.